Well, good morning, everybody. This is Mark Ittleman, speech-language pathologist, and welcome to the Teaching of Talking. This particular video is going to be a straightforward shot right at you, and it's called Motivation in Speech Therapy. And I've been thinking a lot about motivation lately because it's a very significant part of the whole speech therapy process. And I've been practicing speech pathology for about 47 years. And so I've been sort of thinking about these concepts and looking back over the decades of work that I've done and kind of formulated some ideas and some conclusions. And one of them about speech therapy for mostly adults and people with aphasia, but also with children, because I've done a lot of speech therapy with both. And one of the things that I've learned through the years is that you really don't have to motivate people to help them speak better. They either are or they aren't. It's just plain and simple. Now, when I first started out practicing, I worked mostly with children. And boy, I would say most of the parents who brought their children to me were motivated, okay? They'd come and they'd come to the private therapy that I'd had. I had an office in Lakeland, Florida, and they'd bring their children. And almost every single one of those kids got better because the parent was motivated. And when the parent's motivated and they are involved in the therapy process, because that's another one of our secrets with the teaching of talking, we train the parents or we train the caregivers. And when you train people and when they're motivated, gosh, you just about always get results. Now, is it the same with people with aphasia? Well, pretty much yes. Many people know that I give lectures all over the world, not so much recently, and that I do a lot of speech therapy online because we travel all over the country. But what we've learned is that the same concepts are true with online therapy too. We see just about everybody we see is motivated. They don't really ask for my help unless they're motivated. You know what I mean? And so that's one of the things that I've kind of concluded, that those who are not all that motivated just don't show up. And the ones who do show up, usually if a caregiver is motivated, then usually the loved one kind of goes along with it because the caregiver is so motivated. But that's not always true, because sometimes we get caregivers who are motivated and their loved ones who have aphasia or apraxia or dysarthria or whatever the speech problem is, sometimes they're not so motivated. And so one of the conclusions, therefore, is this. You really don't have to motivate people to reach an improved status in speaking with speech therapy. The bottom line is, if they're motivated, they'll work and they'll practice. And if they're not motivated, they won't. And there have been so many people who've contacted me and they've said, well, my husband isn't motivated, or my wife isn't motivated. What can I do to motivate her? There's a final point, and the final point is this, that if you know the right tools, and if you have the right tools, and you're a nice person, and you have a nice therapist, and you teach the client or the patient and the caregiver together, and if the therapist is nice and personable and teaches people very simple little steps that they can do and be successful with, well, they stay motivated that way too. So that's the other key point of motivation, that if you have a nice therapist, if they present material to you that's simple and easy, if they train the caregiver so the caregiver can help the person at home, and the caregiver doesn't step on the person's toes who's got aphasia, and they're working together, because when they work together with a good therapist who's nice, that therapist makes sure that the care partner is trained and fully capable. And when that happens, the person with aphasia or apraxia or whatever it is usually responds, because nobody's telling them what to do, nobody's stepping on their toes, and nobody's giving them stupid stuff like a lot of people get. You know, they're not being given AAC devices, they're not being given worksheets. They learn how to interact and talk with each other and improve talking, because the best way to improve talking, guess what, is talking back and forth in a very simple way, the teaching of talking way. So this is Mark Edelman. I hope you've enjoyed this little video on motivation. People who are motivated are motivated. People who are not motivated are not motivated. And you can help instill motivation if you're nice and if you've got simple methods that you teach in a very easy and simple way. So we hope you liked this video. If you did, please give us a thumbs up. Subscribe to our channel, if you will. Down below underneath the video are a bunch of links. So if you're interested in getting personal mentoring by me, or if you're interested in independent study of the teaching of talking method for either aphasia or apraxia, we have an aphasia video program that walks you through each step that you can do individually, and we have an aphasia book and a apraxia book that will teach you how to help people who have either aphasia or apraxia. So I hope you have a great day today. I look forward to seeing you, okay? So have a great day and see you soon. Bye-bye now.